Hello, everyone. Welcome back to PodBites, where we break down complex medical topics into bite sized pieces, perfect for your commute, coffee break, or whenever curiosity calls. I'm your host, Seif, and joining me for today's episode is my dear friend, Shimy.
All right. Hey everyone, I'm so elated to be here today. Today's topic is addiction.
Despite how common addiction is, it remains deeply misunderstood. It's not simply a matter of willpower, but a chronic condition shaped by neurobiology and environment.
So, we're going to explain the brain circuitry behind addiction, why cravings happen, why just stop doesn't work, and then we'll go substance by substance alcohol, marijuana, stimulants like cocaine and meth, opioids, and end with a quick note on psychedelics.
Let's start with the reward pathway. What are the main structures involved here, Shimy?
The dopamine cells are located in the ventral tegmental area, aka the VTA, and they connect to the nucleus accumbens and to the frontal lobe too. The more dopamine secreted in this pathway, the more rewarded and happy we feel.
So, dopamine is basically the brain's internal quote unquote gold star.
Yes, and the survival brain uses it to push you toward food, water, and intimacy.
So, when something spikes the dopamine, your brain tags it as important and you need more of it to survive. How does this apply for drugs of addiction then?
At first, drugs cause a huge dopamine surge, like from 100 to 900. That feels amazing, especially the very first time. It's a game changer. But a few hours later, dopamine doesn't just go back to baseline. It drops way below normal, sometimes down to 30 or 40. When dopamine is that low, the person feels miserable. He might feel angry, sad, empty, unmotivated, and it's hard to function. Even getting out of bed feels impossible. The brain registers this as a threat to its own survival.
So, they go back to the drug, not to feel high, but just to feel normal.
Exactly. What started as pleasure becomes a life or death need in the survival brain.
Cravings get triggered by random things like a smell or a song. Can you tell us more about that?
Yeah, of course. So, because drugs create what we call the drug hypermemory, everything is erased. But the only memory that stays strong is the drug. Everything around the drug becomes engraved as important: the music, the bottle color, the smell, the people, even the place.
So, the environment becomes part of the addiction.
Yes, exactly. The brain associates it with the drug. Also, safe, keep in mind that yes, there is increased dopamine early in addiction, but then glutamate increases. That glutamate spike decides the drug is essential for survival and makes the frontal lobe look for it. This is called salience, meaning distinguished or highly important.
Oh, makes sense. So, let's briefly talk about the survival hierarchy.
Of course. So, normally the midbrain prioritizes survival needs, like eating, defending yourself, and intimacy. But in addiction, the drug becomes number one on the list. Unconsciously, the person feels drugs are more important and more essential than food, family, or anything else.
This sounds quite miserable.
Yeah, it really is.
So, where does the frontal lobe fit into all of this?
The frontal lobe normally balances midbrain demands, like you want food? Fine, we'll get biryani. Or you want love? Okay, we're getting married. But the dopamine surges with drugs are too strong. The midbrain stops listening, the frontal lobe can't handle it, and over time, the frontal lobe becomes weaker while the midbrain becomes stronger.
So, the frontal lobe cannot speak sense into the person anymore.
This is described as failing top down control, or the frontostriatal dysfunction theory. Then, there is also damage and dysfunction involving the anterior cingulate cortex and orbitofrontal cortex, which are tied to empathy, impulse control, emotion, and decision making.
So, what happens to the normal rewards of life, like finding a car wash that only costs $20?
For neighborhood kids, $20 feels great. For Bill Gates, it means nothing. Addiction changes the hedonic tone. Normal rewards become meaningless because their brain got used to extremely high dopamine.
So, playing football, going to the gym, or spending time with family and friends, all of that gives small dopamine compared to the drug.
Exactly.
What about people who say if I only use it occasionally, I cannot be addicted?
Hmm, Nobody wakes up and decides to become an addict. Addiction is a process, not an event. Occasional use can become frequent use, then constant use. And nobody knows when the chemical switch flips. It's like a Russian roulette. You never know.
So, what are some risk factors that make someone more likely to get addicted?
Genetics is the most important. They may account for up to 60% of vulnerability. So, a family history of addiction is very significant. Other risk factors include younger age of first use, childhood trauma, learning disorders and ADD or ADHD, and mental illness like depression, bipolar disorder, psychosis, or personality disorders. Many people self-medicate, like someone saying, "When I smoke marijuana, I feel normal," which can hint at underlying ADHD, anxiety, or depression.
So, prevention and early treatment of mental health matters.
Yes, exactly. The most important thing in treating addiction is prevention.
But wait, why is young age a risk factor?
The younger the person when these chemicals are introduced, the greater the risk to brain development. People who start smoking at age 9 to 10 may be smokers forever, while starting after 25 makes quitting easier. More than 4 in 10 who drink before age 15 will become alcoholics. In fact, 95% of adults who are dependent on or abusing alcohol started drinking before the age of 21.
So, since you mentioned the drinking statistic, let's move into alcohol.
Alcohol is a CNS depressant that enhances GABA A activity and inhibits NMDA glutamate receptors. Over time, the brain compensates by downregulating GABA and upregulating glutamate.
So, when someone suddenly stops drinking, you remove the alcohol inhibition and you get unopposed glutamate, which causes hyperexcitation.
Yeah, withdrawal can begin as early as 6 hours after the last drink. It can persist for weeks and ranges from mild anxiety and shakiness to severe complications like seizures and delirium tremens. Delirium tremens is characterized by confusion, rapid heartbeat, and fever, with an estimated death rate of 1% to 5%.
So, what is the withdrawal timeline?
First, we have stage 1, which is 1 to 8 hours after the last drink. Here, we see anxiety, abdominal pain, and nausea. Then, stage 2, which happens 1 to 3 days after. We see high blood pressure and high body temperature. Finally, stage 3, which is around more than a week. Withdrawal gets super serious here. We can see fever, seizures, and hallucinations.
Can they go cold turkey?
It's not really safe to quit cold turkey. Alcoholics need a detox program with medications to replace alcohol safely.
And what health problems can occur with alcoholism?
You'll mainly read about Wernicke-Korsakoff syndrome due to thiamine deficiency. It's a chronic deficiency that can cause Wernicke encephalopathy with impaired eye movements and balance, enlarged ventricles, and damage to the mammillary bodies. We can also see dilated cardiomyopathy with these patients. Many alcohol-related deaths are from heart problems because alcohol is toxic to the heart muscle and enlarges the ventricles. There are also a lot of long-term consequences like liver cirrhosis, esophageal varices, aspiration pneumonia, pancreatitis, and gout. But again, the most fatal is dilated cardiomyopathy.
Okay, so this is a very classic exam question. Do we give alcoholics glucose first or thiamine first?
Thiamine first! Alcoholics already have low thiamine. Giving glucose first uses up thiamine and worsens the deficiency. So treat with thiamine injection first, then follow with glucose. And there is also a helpful mnemonic for this, B before G. So thiamine, which is vitamin B1, before glucose.
What about alcohol in pregnancy? I've heard a lot about fetal alcohol syndrome.
Fetal alcohol syndrome is a consequence of prenatal alcohol exposure. It has a classic triad, which is growth restriction, CNS abnormalities, and some characteristic facial features.
Like what?
Like short palpebral fissures, smooth philtrum, and a thin upper lip. If you see those features in a child with developmental delay and a history of maternal alcohol use, fetal alcohol syndrome should be on top of your diagnosis. And remember, there is no safe amount of alcohol in pregnancy.
So any amount is harmful. So we mentioned thiamine. What else should we consider when treating alcoholism?
For acute intoxication or withdrawal symptoms, we use thiamine and benzodiazepines. For more severe cases, we give naltrexone, accumbens, and disulfiram.
Wait, naltrexone, isn't that an opioid receptor blocker?
You're absolutely right. Naltrexone decreases pleasure by blocking opioid receptors. So drinking alcohol becomes like drinking Vimto or Pepsi. No pleasure. And the person eventually stops. We can also give accumbens, which decreases cravings and makes quitting easier.
So thiamine, benzodiazepines, naltrexone, acamprosate, and there's one more, disulfiram.
Yes, another thing we can give is disulfiram. This blocks alcohol oxidation at the acetaldehyde stage, causing acetaldehyde accumulation and unpleasant symptoms like severe nausea and vomiting, so the patient avoids alcohol.
So disulfiram makes the intoxication symptoms worse, making them hate drinking.
Yeah, think of it as a form of negative reinforcement.
Alcoholism seems to be pretty common. They need some social support.
Yes, AA meetings. A group of about 15 alcoholics meet weekly or twice weekly to talk about their problems and how they overcame them. Seeing other people's progress can help motivate an individual to not break sobriety.
Okay, let's move to another substance of abuse, marijuana.
Ah, yeah. Weed, marijuana, Mary Jane, devil's lettuce, hashish. All of these refer to products made from cannabis. Marijuana has become controversial, actually. It's widely used and legalized in some parts of the world.
Marijuana has two components.
Yes, THC and CBD. THC is the part that makes someone high and addicted. CBD is the useful part of marijuana that has some medical uses like for anxiety, depression, and ADHD. But when people smoke marijuana, they take in both THC and CBD, so they get both effects, the good and the bad.
How does that work?
We have cannabis receptors throughout the body, CB1 and CB2. So there is a cannabis system all over the body.
What about its effects on the brain?
It inhibits the amygdala, so anxiety decreases and the person feels calm and relaxed. So as we said, someone with an underlying anxiety disorder may use it to feel calm. Other than inhibiting the amygdala, it activates the nucleus accumbens, so you feel happy and rewarded. It can also decrease pain via receptors in the spinal cord, so some cancer patients use it to help with pain and nausea. And finally, it affects the hypothalamus, increasing appetite, hence why we see the munchies associated with marijuana.
Wait. Let me just recap. It makes you calm, happy, pain-free, and it increases the appetite. So when someone says they're stoned, it means
It means there is decreased activation of the amygdala, less emotion, less facial reaction, and less anxiety.
marijuana is also lipophilic. I would imagine that means it also stays long in the body.
Yes, if you smoke marijuana today, it can show up on drug screening even after 30 days because it stays in the brain for a long time. So it's described as slow.
And there has to be some adverse effects, of course.
Definitely. It can cause lung irritation, increased heart rate, temporary psychosis, impaired judgment, and respiratory problems like cough and increased lung infections.
What about personality and development? I would imagine being in such a slowed state for long would affect the brain a lot in the long term.
You're literally describing a motivational syndrome. An active, motivated person turns into someone with no motivation and no care in life, who just wants to smoke. Other personality changes would be developing magical thinking, introvertedness, regression to earlier age in terms of behavior, and being dependent on others emotionally and financially. All are a part of the amotivational syndrome.
This has to hurt the brain development, especially in teens.
You're absolutely right. It can lead to an IQ drop of up to 8 points. Other than all of these effects, it also affects white matter development because cannabinoid receptors are present in the white matter.
Someone call in Walter White and Jesse to warn them. We're heading into stimulants. Let's start with methamphetamine and captagon.
Meth causes an extreme dopamine surge, but over time, This constant overstimulation actually damages the dopamine system itself. The brain responds by reducing the number of dopamine receptors and decreasing natural dopamine production.
So, because of the constant dopamine stimulation, there is downregulation of the receptors.
Absolutely. Then, when the person isn't using the drug, dopamine levels are extremely low. They feel emotionally flat, unmotivated, and numb, sometimes with reduced facial expression.
That's why users can appear dull or expressionless.
Exactly. Meth also causes intense vasoconstriction, meaning blood vessels tighten and reduce blood flow. This damages tissues over time, leading to skin lesions, poor wound healing, and the classic meth mouth, which results from dry mouth, tooth decay, and neglect of hygiene.
Now, cocaine, coke, snow, how does it work?
Cocaine increases dopamine in two ways. It increases dopamine secretion and it blocks dopamine reuptake. It also triggers release of norepinephrine, causing increased heart rate, blood pressure, and motor activity, plus vasoconstriction.
I would imagine this leads to pretty severe side effects.
Yeah, and it can even be deadly. Cocaine can kill in multiple ways, most commonly due to heart attack, overheating or hyperthermia, and brain damage. Even after a low dose, you're 24 times more likely to have a heart attack. This is because of vasoconstriction plus increased heart rate.
Wait, why is there brain damage?
Brain damage happens because cocaine increases blood pressure, which increases the risk of blood vessel rupture in the brain.
And hyperthermia?
Hyperthermia can cause organ failure and death. It occurs due to increased motor activity and dopamine-related temperature regulation.
All right, next we have opioids.
Woo! Finally, opioids. So, opioids come from the opium poppy plant. Opioid receptors are present in the brain, GI tract, and spinal cord. The endogenous opioids that we naturally have in our body are endorphins.
So we actually do have natural opioids in the body?
We do. Imagine? Opioids increase dopamine by activating the reward pathway.
Wait, let me remember. The nucleus accumbens and the ventral tegmental area.
Right. So dopamine in those areas make you feel relaxed, happy, and less anxious. It makes you need more of it.
Do opioids work anywhere else in the brain other than the nucleus accumbens and the ventral tegmental area?
Yes, of course. It works on the limbic system, causing pleasure, relaxation, contentment. It also works on the brainstem, slowing down breathing, inhibiting cough, and reducing pain. Finally, it works on the spinal cord, where it reduces pain sensation.
So why do people die of opioid overdose?
Many overdose deaths happen because they stop breathing. Opioids are CNS depressants. When they inhibit the respiratory center in the brainstem, that stops breathing.
And how do you treat opioid addiction?
You use buprenorphine, also called Suboxone.
All right, we have finally reached our last group of drugs for this episode, psychedelics.
Oh, whoa. LSDs and magic mushrooms or shrooms. Basically anything that contains psilocybin, which is a psychoactive compound that causes hallucinations. These drugs were highly abused in the 60s and the 70s. There is some research for their use for depression in America. Although they're not approved yet, they may be considered in the future.
So the main effect is the hallucinations.
Exactly. They can cause visual hallucinations and also altered perception of time, as well as anxiety and panic. Important to note, though, they do not cause addiction.
Okay, before we wrap up, I just want us to point out something. Which of these drugs of abuse is more common?
In Saudi Arabia, the most common drugs are marijuana and methamphetamine. On the other hand, in the US, opioid abuse is referred to as an epidemic. In fact, there were around 16,000 deaths in 2010, and unfortunately, there's much more now.
Thank you. Let's take a quick practice question. What effect does smoking marijuana have on the amygdala? A. It increases activation, leading to heightened anxiety. B. It has no effect on the amygdala activation. C. It increases activation, reducing anxiety. And D. It inhibits the amygdala, causing emotional numbness.
I would go with D, actually. Smoking marijuana inhibits the amygdala, resulting in reduced anxiety but also causing emotional numbness or a lack of emotion and feeling, a state commonly referred to as being stoned.
All right, time to recap. Addiction starts in the brain's reward pathway, where dopamine is released from the VTA to the nucleus accumbens, teaching the brain what feels rewarding and worth repeating. Drugs hijack this system by causing massive dopamine surges, followed by crashes that make the person feel empty, miserable, and driven to use again just to feel normal.
Over time, addiction rewires the brain. Glutamate strengthens drug related memories, cravings become triggered by environments and cues, and the frontal lobe loses control over impulses. This creates a shift in the survival hierarchy, where drugs become more important than food, relationships, or anything else, while normal life rewards lose their meaning.
We also talked about risk factors, especially genetics, early age of exposure, trauma, and mental health conditions like depression or ADHD. Addiction isn't a sudden choice, but a gradual process where occasional use can evolve into dependence, especially when exposure happens during brain development.
Then we explored alcohol, a CNS depressant that enhances GABA and suppresses glutamate. Withdrawal causes dangerous hyperexcitation, including seizures and delirium tremens, and long-term use can lead to Wernicke-Korsakoff syndrome, cardiomyopathy, cirrhosis, and fetal alcohol syndrome. Treatment includes thiamine before glucose. Remember, B before G. Benzodiazepines for withdrawal, and medications like naltrexone, acamprosate, and disulfiram to support recovery.
Next was marijuana, which acts on CB1 and CB2 receptors, reducing anxiety through amygdala inhibition and increasing reward through dopamine pathways. But chronic use can cause impaired judgment, psychosis, amotivational syndrome, and even long-term IQ decline, especially when use begins during adolescence.
We then covered stimulants like methamphetamine and cocaine.
Methamphetamine causes massive dopamine surges that eventually lead to receptor downregulation and reduced natural dopamine production, leaving the brain unable to feel normal motivation or pleasure without the drug. At the same time, severe vasoconstriction damages tissues, causing skin lesions, poor healing, and the classic quote-unquote meth mouth, while users appear emotionally flat and numb due to chronically low dopamine levels.
And the other stimulant, cocaine, massively increases dopamine by both increasing its release and blocking its reuptake, while also raising norepinephrine levels, which causes intense sympathetic stimulation like tachycardia, hypertension, and vasoconstriction. This combination makes cocaine extremely dangerous, increasing the risk of heart attack, brain hemorrhage, and fatal hyperthermia, even after a single low dose.
We also discussed opioids, which activate opioid receptors and increase dopamine, while suppressing the respiratory center in the brainstem. This explains why opioid overdose causes death through respiratory depression and why treatments like buprenorphine help stabilize recovery.
Finally, psychedelics like LSD and psilocybin primarily cause hallucinations and altered perception without causing addiction. The biggest takeaway from today's episode is this: addiction is not a failure of character. It's a disease of brain circuitry that alters motivation, memory, and survival priorities.
Understanding the neuroscience behind addiction helps us replace judgment with empathy and focus on prevention, early intervention, and proper treatment. Because recovery starts with understanding how the brain was changed in the first place.
Absolute cinema! And that wraps up today's episode on substance-related disorders.
Thanks for listening to PodBites. See you next time.
Peace. Woo! No way. شغل فاخر. Like, you want food? كان في voice crack. Okay. The younger the person when these chemicals are introduced, the greater the risk to brain development. Development. Okay. The younger the person when these chemicals are introduced, the greater risk to brain ايش صار؟ development. ايه قولها كده.
development الستريس is PEL development.
Okay. The younger the person when these chemicals are introduced, the greater the risk to. أنا
اسمع قولها بالطريقة اللي بتنفع معك.
ماشي. Yeah, like the facial مش عارف. It can be. The facial features are short palpebral. Like إيه؟ Okay.
بس مر عليهم أول قبل ما عشان.
Short palpebral features, smooth filtrum, and thin upper lip. Okay. Like. Okay. Like. Like. Okay. طب ما أنت ممكن تقول like what كده بس this is not part of the recording عشان يعني أخدها على طول. جميل. We'll cut it off يعني.
Like what?
Like short like. هقولها كده okay. Okay.
So any amount is harmful. So we mentioned.
لا. So any amount is harmful.
طيب كنت داخل كده طيب مشكلة.
And how they overcame them. So أنا ليه عمال أقعد أهبط أنا ماشي.
طلع برا السكريبت.
طلعت برا الأوفيس أصلاً. Seeing other people's progress can help motivate an individual to not break sobriety. Sobriety. Okay. Seeing other people's progress can help motivate an individual. Sorry, guys. Seeing other people's progress can help motivate an individual to not break sobriety. Alrighty. Other personality changes would be developing, صح? Other personality changes would be يا ربي. Okay. Other personality changes would be developing.
أحس شيل developing good would be magical thinking introvertness.
مش عارف ليه
شيل developing.
developing. يلا. لا أنا لازم أواجه المصاعب. Other personality changes would be developing. إيه؟
Developing. أيوة.
Okay. Developing. Okay. Someone calling Snoop Dogg to warn him.
مبدئيا يا أخي طبعا على الأقل خلينا نستخدم تاع بريكنج باد داك اللي بيعمل الميثامفيتامين.
والله
أحسن من سنوب دوغ.
والله أنت أدرى.
منو اللي بيعمل والتر وايت؟
Someone calling Walter White to warn him.
أحسن صح؟
Yeah. حلو. Yeah. لا احنا we're gonna talk about meth.
في الميث. والتر وايت أحسن من سنوب دوغ صح؟
حلو ده.
Alright, next we have opioids.
Yay, woo! Opioids. يا ربي. Sorry. تحمس.
لا عادي.
Basically anything that contains psilocybin, which is a psychoactive hallucinogenic compound that causes hallucinations. Hallucinogenic. Okay. Basically anything that contains psilocybin, which is a psychoactive hallucinogenic. طيب. حسيت إنه hallucinogenic. Okay. Basically anything that contains psilocybin, which is a لا أنا قلتها غلط. Basically anything that contains psilocybin, which is a psychoactive Sorry guys.
Okay.
Hallucinogenic. Basically anything that contains psilocybin, which is a psychoactive hallucinogenic compound that causes hallucinations. ما حسيت it's yeah. يعني كل ده والتعب يعني طب ما كمل الأول. Okay. Finally, psychedelics like ليه بهبد أنا؟ خليك ماشي على السكريبت.
يلا
كده ممكن أقول finally. Okay. No? It's a disease of brain circuitry that alters معلش يا عم
لا لا كمل
هنلحق السحور ان شاء
إن
الله.
شاء الله.
It's a disease of brain circuitry that انا ليه بوقف. It's a okay.
Understanding the neuroscience behind أنا خلاص وصلت.
خلاص احنا خلصنا.
Because recovery starts with understanding how the brain was changed in the first place.
Absolute cinema. And that wraps up
ايش دخل؟ طيب.
I have to put it. ايه؟
Absolute.
Cinema. Yeah. Okay. Absolute cinema. And that wraps up today's يا رب. Okay. قولها تاني. And that wraps up today's episode.
Wraps up today's episode.
And that wraps up today. في episode. Absolute cinema.
خلاص.
And that
نبدأ؟
wraps up today's
wraps up today's
episode on substance related disorders. ماشي.